Thanks for making time. So I'm Ali. I'm the founder of UpChoose. And I'm super excited to host Catherine, who's the founder of Anja Health. We know each other, I think it's been a couple of years now.
Yeah,
Been, closely following the great work that you do. We're both,
thanks.
trying to bring something of value to help new parents.
Yeah,
So yeah, so with that being said, you've been focusing on cord blood banking, which is something that it seems like, a lot of people don't, some people not know exactly what it is,
hmm
and then some people have a very strong opinion about what it is.
yeah,
So I guess, maybe we can just start by hearing about yourself, your story, what brought you to start such a, unique and very specific company.
yeah, definitely. Yeah, so my younger brother had cerebral palsy from a near drowning accident, which gave him pretty severe brain damage. So he was unable to walk or talk. And something that's really promised cells from their own umbilical cord and being able to see motor and social skill improvements from the stem cell regeneration from the damaged cells in their brain. So yeah, my family always looked into finding cord blood stem cells that my brother could use, but it would have been most optimal if we had saved his or my stem cells. And we ultimately, unfortunately, didn't do that. So we tried to find a donor, but it's typically really difficult to find a donor if you're a person of color or mixed race. And so, yeah, from there, when my brother passed away, I wanted to do something that would have been able to help him. And I think this is definitely something that if like my parents had access to it, would have been able to help him. So yeah, so that's why I founded Anja Health, and so his name was Andrew, so the company's name is Anja. So yeah, now we're on a mission to make sure that parents feel informed about this, that they can walk into birth feeling like they know about their options and their choices, and they feel confident about their choices. And yeah, and we can just help folks like get access to stem cells and different disease treatment options, whatever it may be.
Well, thank you for sharing. I know you're sharing this story all the time, but it's yeah, it's very touching, and I know it must be hard for you to share it all the time as well. But
It's okay.
um, yeah, so I mean, if you had to explain, to someone who's never heard of, stem cells before, like if we were to really go back to, like explaining it to a 10-year-old or something like extremely basic, like how do you usually go about that?
Yeah, it happens more frequently than you would think because most, especially young men, don't know about cord blood thinking. So, especially if I'm at, for instance, like a founder function, it definitely leans predominantly male. And so,
Mhm.
usually I explain it as we help pregnant parents freeze stem cells from their umbilical cords and placenta to use for future disease treatment. And usually people are kind of like, wait, like, can you repeat that again?
Yeah.
Like, it's kind of hard to grasp, but yeah, but basically we have a kit that pregnant parents can bring with them to birth. And then from there they can use all the tools in the kit to collect the umbilical cord and placenta, and then send it off to our lab where we will process it for its stem cells. So very similar to freezing eggs and sperm, where it's processed in a lab and then cryopreserved at around negative 190 degrees Celsius. So that's like what we physically tangibly do, but I think ultimately the broader mission is increase access to stem cell treatments, and allow parents to just have like one additional treatment option when they're looking at any family member that might have an ailment that needs to be treated.
So, it's interesting because I know how, hard it is to start a company, uh, especially a company like a healthcare company that has any kind of physical process attached
Yeah,
to it, right? It's not just software. And you've done amazing uh, job to like put the brand out there, create a company, have extraordinary backing. You're part of Y Combinator. You have great investors. Like I'm really curious how you were able to you know a, like push through your thesis in that world
yeah,
that is very much used to like very strong growth numbers, like models that scale very rapidly and very easily, or not like easily, but like, viral loops and all that. Like, how have you, to me, it's clear that you've done something extraordinary just by putting that kind of, company in that kind of world. Yeah,
Thanks.
can you talk me through some of the, I don't know, feedback or pushback or tactics
Yeah.
that you used?
Yeah. I mean, I think a lot of investors were just a lot of feedback that I got was kind of along the lines of like, finally, like not a B2B SaaS company.
Yeah.
And so, yeah, I thought that was really interesting because, yeah, I was surprised at how moved people were by the mission. Although, like, I didn't really know too much about venture capital, but I guess knowing what I know now about venture capital, and sort of the landscape. I think, yeah, people are just inclined to things that have a personal backing because it's kind of rare for startups to have like a very personal connection to the mission statement. I think especially when you look at like B2B SaaS companies or something like that, it may not necessarily be like a huge problem statement that the founder necessarily feels very personally connected to. Although it produces like a good business and they tend to be passionate about like engineering and product and such. So yeah, so I think I just felt like touched that other people were able to resonate with the mission as well, and feel like they could see it too and be a part of it. So yeah, I think a lot of it was just like being a part of a mission driven company, which I didn't realize was as rare as it is. But yeah, but seems like it definitely is like rarer in the startup world.
Yeah, and like early on, how did you? It's funny because we had a little chat just before, and we said like, let's not talk too much about like startups and like getting customers.
That's
But you know
okay.
what? It's yeah,
Yeah.
it's funny because I was gonna ask you like, how did you get your first customers? Because in a way, like what you have to demonstrate when you're trying to get up and running is that there's demand for it. And
Hmm.
in your case, it's a little bit challenging, I suppose, to get your first, parents to trust your service. So I'm just curious about how those first happened, and if these were in like specific family history, like what got them convinced. Was it purely on the basis of the science, or did they have some, family history where they knew already that they wanted to do, cord blood banking?
Yeah. Yeah, it was largely through social media. So, I actually worked on a consultancy prior to doing this company. I founded a consultancy called Bridge Strategy, and we were helping small businesses and startups figure out how to go to market and things like that. So yeah, I think my number one piece of advice for every business was to get on social media, even if it's like really low fidelity social media. I think some kind of content you can learn from rather than having no content out there. And I feel like you guys have done a really good job of this too. Like your Instagram presence is really strong. So yeah, I feel like contemporary brands need to meet customers where they are, which is on social media. And I think like consumers are only getting more social media native. So yeah, so when I first started this company, I knew that I wanted to take the advice that I had given my consulting clients and tell them to get on social media. And so I got on social media, and that's really how I found our first customers, was to just be producing constant social media content, and getting feedback that way, and yeah, incorporating it into what we do.
Yeah, I have a big like, love-hate relationship with social media. Like you have to love it when you're a young company because,
Yeah,
it's a channel to the world.
yeah.
Uh, but it's been like in the past, I don't know, 5 years, um, they've just been like pushing us nonstop to,
Hmm.
live inside of those, apps as opposed to just having a presence.
Yeah. Well, you guys do a really good
Yeah.
job with it. I think a lot of
Thanks.
yeah, a lot of brands don't necessarily know how to curate an aesthetic even, but yeah, I feel like you guys have a strong aesthetic, strong following, good engagement. So, yeah.
Yeah, I mean, we've never really sat down and said, this is going to be our aesthetic, this is going to be our Instagram. Like the only thing that I've always knew was from the very beginning that, I'm not a mom and
Mhm.
I wasn't a parent at the time. And, I'm not good, or that's not my thing to be the face of a brand and be out there. And
Yeah.
also we're not the kind of company where the founder went to their room and spent, 3 days coding something, and like invented the solution. It's much more
Yeah.
something where it's like, let's reinvent the rules of the game, collectively. If we all do things in a smarter way, we're all, going to benefit. And so everyone has a sense of ownership in the
Yeah.
shared mission. And so as a result, from very early on, I mean, first of all, as a founder, I was absolutely, forced to be a, a better listener, right? And to learn about, customers and their journeys and their experiences. And also it felt more interesting as a company to be that sort of collective movement, like everyone is participating. And so the voice of the company should be the voice of everyone, doing the work every day.
Yeah.
And so our parents, or members, tend to be the ones who more often, are given the mic,
Yeah.
to share their experience, to be out there. Um, so yeah, it's worked extremely well, I would say, for us to, just create a little bit of the essence, of the
Yeah.
company. But then, yeah, it's always a challenge to have that, social media presence, because every time you try something, you might be, behind the curve, and the algorithm is changing all the time.
Yeah.
So anyway, okay, so back to your work. Like, if we try to go a little bit more in details in terms of like medical, conditions or situations. um like, I get that the, high level is, it's good to freeze your stem cells and store them and have them available, if anything happens, like you have
Yeah.
you have like a much better chance to, treat something.
Hmm.
um, but it does seem that the spectrum of things that can happen and the spectrum of things that can be addressed, with this is very broad.
Hmm.
Like, can you walk me through a bit? Because I hear about anything from diabetes to autism.
Yeah.
Like,
Yeah, for
what's the
sure.
state of affairs for that, and where's the research on that?
Yeah, yeah. So the FDA has approved around 85 diseases to be
Who?
treated with
The
cord blood.
you
The
said?
FDA.
Yeah. Yeah.
Yeah, yeah.
Okay.
The FDA has approved around 85 diseases to be treated with cord blood stem cells in particular. But there are about 1,000, a little over 1,000 ongoing clinical trials looking at other use cases as well. And so, yeah, for instance, cerebral palsy is like very publicly a use case for cord blood stem cells, but is primarily a use case within the context of clinical trials. And yeah, so a lot of the FDA approved diseases are rare blood cancers and kind of things where cord blood stem cells is really the only option for treatment. And then the clinical trials are looking at whether cord blood stem cells can be a more effective treatment than kind of existing treatments, or just, yeah, generally improve conditions. So, yeah, I think slowly within the past 10 years or so, the FDA has approved more and more diseases. So the idea with other folks that I've talked to in the industry is that over the course of the next 10 years, like that will only continue to accelerate and clinical trials will advance towards FDA approval. But yeah, so a lot of the FDA approved diseases are really rare blood cancers, um, kind of disorders, neurological disorders. And then a lot of the clinical trials, a majority of them are focused on cancers, specifically of the brain, breast, bladder, yeah, liver, heart, yeah, things of that nature, and just like cancer related to those organs. And that impacts those organs. And then secondarily is cardiovascular diseases. And then the tertiary category is musculoskeletal diseases. So yeah, anything from multiple sclerosis, sickle cell anemia, and yeah, like I mentioned, different types of cancers. Autoimmune diseases is a common one. And then there's a lot of early research looking at other use cases too, like you mentioned, type 1 diabetes and autism. I would say the research there is still very early, but it's definitely very promising. They've been able to see type 1 diabetes improvements in mice with cord blood stem cells, and have like used it more rarely with humans as well.
Hmm.
And yeah, with autism, a lot of it is not been like really, there haven't been like focused studies on it, but especially in Europe, I've talked to quite a few physicians that have administered treatments for autism and other neurodegenerative diseases, and generally like see that as the primary path forward. So yeah, it kind of depends on the disease itself, but research is at different places with different diseases. And I think in general, the consensus is that it'll continue to advance on all
And
fronts.
do you see like a big difference between, I don't know, the US and Europe or other parts of the world?
Yeah, I think in Europe, well, first of all, there are less cord blood stem cells being banked, but they are used more in Europe.
Hmm.
And we actually just did a podcast with a physician in Europe about this on the Anja Health podcast. But yeah, he was kind of saying he finds that to be quite ironic. And in the US, people do bank, like the frequency of banking is higher, but a lot of parents are just not kept informed about what it could potentially be used for. So then it ends up kind of dropping off. But in Europe, a lot of physicians are really inclined to stem cells, especially cord blood stem cells. And there's a lot of clinics and less regulation involved in administering those treatments. So yeah, this physician in particular was telling me that his daughter even has a neurodegenerative disorder. He didn't disclose what exactly it is, but he administered a treatment for her, and he's also administered treatments for autism and other diseases. He focuses specifically on neurodegenerative diseases, but yeah, in general, he felt like it was like for sure the future of treating neurodegenerative diseases, and cerebral
Hmm.
palsy, I would say, is one of those as well, which has had a lot of promise in clinical trials too.
And so for clinical trials, like just to go back to the basics on that as well, like who's running them? Um,
Yeah.
yeah.
Yeah, it kind of depends on what the disease is. But for instance, the clinical trial for cerebral palsy is really spearheaded by Dr. Joanne Kurtzberg out of Duke University, and she
Okay.
spearheads a lot of the cord blood stem cell research. So yeah, generally researchers slash physicians slash like folks out of research institutions.
And so, I'm involved in some initiatives around clinical trials as well, clinical
Oh,
studies,
cool.
where I came to learn a little bit that a big challenge in the US is to recruit people to be part of the
Oh,
studies.
okay.
Um,
Interesting.
I don't know in your space, but for example, in even in space, related to nutrition,
Mm.
or like food related, like health plans or things like
Yeah.
that. Um, like in your case, I know it's not something that you do directly, but have you heard of like how do they recruit? Do they recruit like parents and young babies to be part of these studies or?
Yeah, I think generally they're toddlers. So yeah, I would say anywhere from like 3 to 9 years old is kind of the the average that I've seen. Sorry, someone just started leaf blowing out my window. Is the sound still okay?
No, it's fine.
Okay.
Yeah, it's okay.
Sounds good. Yeah, so yeah, I think it kind of varies depending on what it's being used for, but most of the case studies that I've read involve children. I think because they're especially able to use their own cord blood stem cells. Cord blood banking has only become more popular in the past 20 years or so, so they would generally like be younger. Also of their because they have a smaller body, they don't need as much cord blood stem cells to be able to treat whatever disease
Yeah.
they have. So
Yeah.
yeah, for all those reasons, they're generally younger. But yeah, from the parents that I've spoken with, I think usually they try to reach out to the physicians that are running the clinical trials to be a part of the clinical trial, and then it depends on eligibility. And there are a lot of folks that are involved in either the research side of things or physicians themselves treating given diseases that ultimately promote, yeah, folks to be a part of those clinical
Okay.
trials.
Interesting. And so in terms of like parents who come to you, say you're posting something on social media, or
Yeah.
like, do you find that there's always the same uh, profile of people, or maybe, concern why people are more, let's say, ready to consider this as an option, or is it
Yeah.
very diverse?
I think it's pretty diverse. It kind of depends on the parent's background. Sometimes, especially if the one of the parents is a physician or has some kind of medical background, they generally have like less questions around the science, and it's more about the logistics. Sometimes, if parents are slightly lower income, then of course their first concern is more pricing and budgeting. So yeah, I would say that the main concerns are generally like how it works, pricing, and the science behind it. So it just kind of depends on how parents prioritize that.
So it's reading that some people are saying that they love this chat and it's super informative.
Oh, awesome.
So yeah, I think, yeah, Instagram Live is pretty cool. Like, we should do that more often.
Yeah, yeah, for sure.
I have to be less shy, I guess. Um, you're not. I know you're quite out there, so I have to learn from you. But that's super interesting. In a way, like, I know the challenges of trying to convince parents of considering different options, right? Like,
Yeah.
in our case, it seems very, um, I mean, it seems very low tech, right? Because you're talking about clothing, and then the challenge is to, funny, like, someone just posted a couple of hours ago, like, a reel, responding to someone's comment saying, like, so she's like, she's an influencer posting on toxicity in clothing, and then
Okay.
someone made a comment and said, well, that clothes, like, we're supposed to wear them, we're not supposed to eat them, so it should be
Yeah.
a problem. And so she responded to that, you saying basically, like, oh, look at my chat with one of the most renowned doctor in the US, talking about how we absorb 30% of what,
Mm,
what we put on our skin, of our clothing.
yeah.
So obviously, if clothing has a lot of toxic chemicals, it could be an issue, especially, in our case, babies and newborns, because their bodies is much smaller, so the absorption is much higher. Um, but even with that, like, our challenge is to have that conversation
Yeah.
and say, oh, clothing can have a health impact. Um, in your case, I imagine this is even, harder, because, granted, on the one hand, you would have parents who have a science background, so
Mhm.
there the conversation is much easier. But for, with someone who has no background, and I mean, if you research things like cord blood banking, you have a lot of opinions out there, and it's not something that is necessarily super cheap, right? Like, I want to, I mean, we're not super cheap either, right? Like, as soon as you try to give, like, a good option, it has good value, so it has a price, and then we can talk about the efforts that we do to try and make it more affordable and more accessible. But I guess for you, are you trying to, like, respond to the, oh, like, this is a scam, or this is trying to get, to prey on people's fear? Like, do you already have a way to try to address that, or is it not a
Yeah.
focus yet?
Yeah, yeah, for sure. Yeah, I think every angle of marketing we've done. So yeah, I don't really shy away from it. I just try to be honest. Like I always circle back to my family story. And yeah, like I don't think it's necessarily yeah, and I think that's often something that resonates with people. Like if I just circle back to my honest answer, which is just generally that like truly this is something that could have helped my family, so I just try to inform others about it, and yeah, and just like see how people respond from there. So yeah, I think I try to respond to everything that I can.
Cool. Okay. Um, the the one thing that I wanted to ask on this is, about delayed cord clamping,
Yeah.
right? It's one thing when I started promoting the discussion.
Hmm.
I've had, and we as a company, um, my yeah, sometimes sometimes I say my mom's, and then if my mom hears that, she gets really she doesn't like it. But like our moms in the and parents, but we interact a lot with moms and dads as
Yeah.
well. But parents in the UpChoose ecosystem have been responding to this, saying like, oh, but you can do delayed chlor camping. Like,
Hmm.
that's even better. Or yeah, how does one, think about cord blood banking versus delayed cord clamping? Like, how are they different? Can you do it together? Is it mutually
Yeah.
exclusive?
Yeah, well, so delayed cord clamping is where you wait to cut the cord. And generally, ACOG currently recommends around a minute. And so, a lot of physicians that I've talked to have said that they generally, like, hospital policy is to do around like 30 seconds to a minute if the baby's premature, maybe slightly longer. But the idea is that it can boost iron levels for the baby, and very similar to a blood transfusion, they can just get extra blood. But I've also read studies where delaying for longer than 2 minutes actually doesn't provide any more benefits than if you just did it for 2 minutes. So we generally recommend that parents delay cord clamping for up to 2 minutes or less. And that usually coincides with what their OBGYN recommends anyway. So it ends up working out. And yeah, we've also had conversations with doulas, for instance, that really are involved with the coordination of cord blood banking and are able to really closely observe delayed cord clamping and see that it goes on for slightly longer if the parent wants to. But yeah, like I said, I think yeah, there's kind of only so much like of an iron boost that it can provide. So at a certain point, there's just diminishing returns with continuing to delayed cord clamping. So yeah, we tell parents they can definitely do both. We just recommend typically like 2 minutes or less, unless you have a really, really thick, juicy cord, then you can potentially have a provider overlook that and do slightly longer if you would really like to, but it always falls into what the OBGYN recommends.
Um, okay, very clear. Thank you. And there's a video that I've seen that was really interesting that basically said, um, it can work wonder. It's true, but it's very, very, very unlikely that you will need it.
Mm,
Um, and if you ever need it, you could just go to a public bank.
mm.
Um,
Yeah.
yeah, what's your take on that?
Yeah, I think, well, so the New England Journal of Medicine published a piece where the chances of survival are correlated to be much statistically significantly higher if you are related to the donor that gives you cord blood stem cells. And so, for that reason, I think it's best to have an immediate related donor at your disposal so that you don't have to try and find a donor. Also, if you try and find a donor and need it, then you will have to like search through donor pools. It can sometimes be quite expensive. It can also be difficult if you're a person of color or mixed race. So yeah, I think the chances of needing cord blood stem cells could potentially be low for families, but if you do need it, then you definitely want to make sure that you have the option available. And the best option available, I would say, would be to have your own stem cells available because it increases your chances of survival. And then you don't have to go through the trials and tribulations of finding a donor. Um, and also, I think it's kind of like an investment into the future of science. Like research can only continue to advance with what cord blood stem cells can be used for. And then lastly, I think one of the reasons why cord blood stem cells isn't used currently is because most people don't have that immediate donor available, and it is very expensive and difficult to find a donor. Plus, if you're not related to the donor, your risk of getting host versus graft disease, aka rejecting the transplant of stem cells, is much higher. And that's why I think the chances of survival are generally lower if you're receiving someone's stem cells that you're not related to, because it puts you at risk for host versus graft disease, which could be fatal. And so, yeah, ultimately, I think folks should think cord blood stem cells because they can potentially access it in the future, and there could be more use cases than what's given today. Yeah.
Okay, cool. Okay, I wanna focus on affordability because a lot of this comes down to money at the end of the day. But let me take a quick pause because I'm gladly seeing that we have some questions. So maybe we
Okay,
can
awesome.
just pick, so people see that we don't ignore them.
Cool.
I think
Okay.
there's one question. Let's start with one question for you. Does it help with type 1 diabetes?
Yeah, so there's early research looking at type 1 diabetes. I've read case studies in China where they were able to reverse type 1 diabetes, and they were able to use cord blood stem cells to do that. So there's one case study in particular in 2012 that was published that was along those lines. And also, there's a lot of more recent early research looking at using cord blood stem cells for type 1 diabetes, where they've specifically looked at mice and things of that nature. So we have a lot of those case studies linked on angelhealth.com/science. But yeah, a lot of parents that I've met who have kids with type 1 diabetes tell me that they look really closely at the cord blood stem cell research space because a lot of physicians believe that that's the next like most promising option for especially children with diabetes. So yeah, I would definitely chat with your physician about it. If you have your own cord blood stem cells banked, then you're not at risk for host versus graft disease. So I would definitely encourage looking into using cord blood stem cells for that with your child's physician, and reading our case studies at angelhealth.com/science.
Yeah, I actually know someone in that situation actually. So I'm gonna follow up on that. But if you
Yeah,
are in a situation where you are, you have a kid, um, say, 6 or 7 years old, and you just discovered that they have type 1 diabetes, um, like what can you do in this regard? Like, because obviously it's too late for your own, stem cells, but what can you do?
yeah. So I would definitely chat with your child's physician about it,
Of course.
about cord blood stem cells as an option. And yeah, you can kind of see what options are available. You could potentially look for a donor. And so, yeah, I think you could just, yeah, explore what's out there. If you do happen to have cord blood stem cells banked, even if it's for that baby or another baby, you could bring that up as well. And I think that that especially would be a really promising avenue.
Okay, cool. Thank you. Um, I think this one is for me. Opinions on expecting moms shopping with Shein Temu products.
That's a good question.
Yeah. Uh, so no, I mean, no opinions other than, and something actually that I had to learn, pretty early on that, um, it's hard enough to, try to, I mean, um, I try to take those things always from a perspective of empathy, you know, like no one is purposefully looking for things that are either toxic or poorly made or potentially harmful. Um, so I wouldn't have opinions on why people do that, but I have a strong opinion on at least two things. Number one is looking at the evidence, right? Like there's been actually recent studies that have found a much higher amounts of toxic chemicals, sometimes called forever chemicals, PFAs, etc., in a number of items from those kinds of websites, and a number of baby products from clothing to bibs to cloth. There's also been investigations that some of those websites were still selling items that were recalled in